Hi everyone. Today we're going to discuss a common ailment of people today. It's congestive heart failure. Congestive heart failure has affected millions of people all around the world, and there's a high percentage of early age mortality due to this disease. To understand congestive heart failure, you must understand that all the organs return blood to the heart, the liver, the lungs, the legs, everything. So when the heart begins to fail or weaken or is unable to pump blood forward, fluid backs up. So then that causes pressure within all the organs. The organ's response usually is for the lungs to become congested or stiffer, and it causes increased effort to breathe. Fluid starts to escape into your alveoli, and fluid interferes with your O2 exchange, which aggravates the shortness of breath. I have a chart here to show you exactly what happens when a person is experiencing heart failure. In this chart, as you see, it discusses that heart failure is a result of decreased cardiac output. Some of the things that occur is there's an activation of the sympathetic nervous system. Then the heart rate is increased. There's decreased blood flow to the renals. The renin-angiotensin-aldosterone syndrome is activated, and arterial and venous vasoconstriction occur because of these things. And then also salt and water is retained, and the heart is what we call begins to remodel. And a lot of times a person will end up with ventricular atrophy or hypertrophy, which basically means the ventricles become enlarged, the walls of the ventricles become thickened. Here's a kind of a chart of what ventricular modeling would look like. As you see on the left side, the interior walls of the ventricles have become very thick, and the shapes of the ventricles have changed because the heart has itself become very enlarged. So as a result, the ventricles will dilate in order to try to get more blood flow within inside the heart. Symptoms that a person will have when they have congestive heart failure, or as we discussed, shortness of breath. They will also experience swelling of the legs. This is the edema that is caused. They have chronic lack of energy and extreme fatigue. They have difficulty sleeping at night because they can't breathe, and a lot of times they will have to sleep sitting up. They also have swelling and tenderness in their abdomen, and they lose their appetite because all their organs are strained. They have a cough with frothy sputum, and they frequently urinate at night, nocturia. Also, they can experience confusion and impaired memory due to this lack of blood flow to the brain as well. Heart failure decreases the blood flow to the brain, as we just said, and it can cause dizziness as well. As you see, decreased blood flow supplied to the kidneys can cause the body to retain salt and water, and decreased blood flow supplied to the legs causes fatigue, particularly during exertion. Also, the liver becomes a factor, and as we know, the liver serves as many functions in the body, and so when the liver becomes damaged, you experience a lot more problems. The clinical assessment that a nurse would have of heart failure would include orthopnea in the patient, tachypnea, the use of accessory muscles by the patient, cyanosis. They will have cool and clammy skin. As we discussed, they would have frothy sputum. Their lung sounds will reveal crackles, rhonchi, or wheezing. They will be tachycardic, and they will either have hypotension or hypertension. Here's a little mnemonic to help you remember how to treat heart failure. It is called Unload Me. The U is for The U is for keep the patient in an upright position. The N is for nitrates. L is Lasix. O is oxygen. A is ACE inhibitors, ARBs or amiodarone. D is digoxin or dobutamine. M is for morphine sulfate. And E is extremities down. So basically, this is a mnemonic to help you remember how to treat a person that's having a chronic heart failure or in an emergent situation. A lot of times patients don't understand what congestive heart failure is and what it can do to the body, so you have to do some teaching with them as a nurse. Main thing to teach them is they must have a low sodium diet. They must have a fluid restriction because that will help them to get the fluid off of them and help them retain less sodium. They must weigh themselves daily. You must teach them when to call the doctor. One of the important signs to know that you need to go see your doctor immediately. And also teach them about their medications, because most people don't understand when they have to take several medications and they think it's an excess and tend to not want to take them all. Overall goals for nursing management is to decrease the symptoms of patients having, like the shortness of breath and fatigue, and help them to get more comfortable. Also to decrease the edema that they experience in their legs, increase their exercise intolerance so they can get around better, help them to be more compliant with their medicine regimen, and also to prevent complications related to heart failure, which could lead to cardiac arrest, complete heart failure, arrhythmias, dysrhythmias, and other problems that can occur due to heart failure. Heart failure has become extremely common in the world today. So it is very important that a nurse learn how to take care of the patient who experiences heart failure and how to teach that patient how to better their quality of life. So because of that, heart failure has been chosen by me to discuss in this video. And I hope you learned something today. Thank you very much for your time. Have a good day.